most foster parents right now report that their medical card works very well, that they're able to take their child almost anywhere in the state and know that they'll get the services they need without question if those services are available. This is one of the few parts of the foster care system that seems to be working pretty well. Instead, we want to establish a $330 million contract, roughly, with a private, probably out-of-state corporation, and $33 million of that would go toward their administrative costs and profits. There's a lot of other things that we could do with $33 million that would help with this foster care crisis. We could put it into prevention. We could put it into much-needed peer support and training for foster, adoptive, and kinship parents, post-adoption supports, better services for children, such as an increase in the number of certified play therapists in the state, treatments for things, very complex issues that many kids in foster care face, like reactive attachment disorder, and trauma-informed providers, which are very, very difficult to find right now. This model also creates an additional layer of bureaucracy for foster, adoptive, and kinship families to manage. So, will the care coordinator be trained in the impact of trauma on the child and the family? Will they be able to act with agility and speed in an urgent or emergency situation? Who do I call in which situation? Do I call my CPS worker, my private agency worker, the managed care coordinator, the guardian ad litem? Who else, who do I call when there's a problem? What will their role be? And it just seems that there are too many questions left unanswered at this date. So we need to slow down this process. At the very least, we need to delay implementation of a managed care model. To try to do this in 6 months just doesn't make sense. And we need to gather much more stakeholder input. Most foster parents had never even heard of a managed care model until just a few months ago, until many months into this decision-making process. This bill needs a fiscal note so that we can properly gauge the costs to the state. And there are real problems that managed care does nothing to address. There are problems like foster parent recruitment and retention, post-adoption supports, foster parent involvement in the process, lack of access to highly effective treatments in state for children who have experienced trauma. And there are a couple other concerns in the bill that I'd like to mention. One is the need to keep children in state for services. It says that a court may not order a child to be placed in out-of-state facility unless the child is diagnosed with a health issue that no in-state facility or program serves. There are many in-state facilities that serve all kinds of different diagnoses but don't do them specifically in evidence-based practices. They treat children in groups with multiple diagnoses, and that often is not the best treatment, especially for a complex condition like reactive attachment disorder. So I would like to make sure that we're not sacrificing keeping a child in state, or not sacrificing quality care for the sake of keeping a child in state. Thank you very much.
Thank you, Ms. Sanders. Next is Pat Vara.
I appreciate the opportunity to address the room today. And my name is Patrick Vera. I work for a place, excuse me, called Academy Programs in Fairmont, West Virginia. We mainly deal with kids residentially that have substance abuse issues and have been engaged in the child welfare system consistently since their adolescence. I want to stipulate to what the first speaker said. In fact, we are experiencing a child welfare crisis, without a doubt. Beyond that, I want to say that this legislation in large part is based upon what Georgia did to supposedly reform their child welfare system. I noticed this morning as I drove through Braxton County and Roane County and Clay County on my way here that West Virginia, in fact, is not Georgia. And instead of giving money to a managed care organization, how about we do a better job of the legislative branch holding DHHR accountable? We didn't get here yesterday. We got here. This has been in the making for many generations. Now we want to punt. The state agency wants to punt responsibility for something that they are charged with in code. There are many poison pills that are in this legislation. I don't have enough time to go through all of them. As a child treatment residential provider, I can tell you one of them is the no eject, no reject policy. I want to go on record as saying that without getting too far in the weeds, but I want this body to know that we oppose that provision in this bill. Also, performance-based standards that are put in the bill that will harm foster care. And as I said, I would be brief, but I want to be poignant. The abject lack of collaboration with stakeholders, which is the nice fancy word to say the people that actually take care of at-risk kids in West Virginia. Kids that may or may not have been incarcerated, may or may not have been in residential settings, may or may not have been in multiple foster care placements. A few years ago, we had the same issue, and we spoke to the people that actually order kids to us. They're judges in our state that actually are some of the best child advocates in this state for children. I would ask, please, that we slow down, study this, and consult better with the judiciary before we move forward. Thank you.
Thank you, Mr. Vera. Sam Hickman.
Thank you, Mr. Chairman, members of the committee, and all those who came out today for this important public hearing. I'm Sam Hickman. I'm the director of the National Association of Social Workers West Virginia chapter, and we are opposed to House Bill 2010 in its current form. The bill takes a scattershot approach to the safety and care of children in foster care. Foster care is part of a complex child welfare system that few understand, and the public generally doesn't think about it until there's a bad outcome for a child. An inadequate reform like House Bill 2010 could do more harm than good, both in the short term and for years to come. Well-planned reforms stemming from the honest engagement of all stakeholders, especially youth and foster care, are needed. But this bill rushes headlong into uncharted waters. DHHR has acknowledged that West Virginia would be the first state to put the physical, behavioral, and social services needs of foster children and families under a managed care scheme. While 41 other states have foster kids in managed care, they do so with different models, and none of them experiment with children's health and safety in this way. When a child is removed from the home, we should acknowledge that we have all already failed that child. This failure may have seemed unavoidable due to prior circumstances. We probably felt that we had no choice. House Bill 2010 is an inadequate attempt to prevent additional failures, additional traumas from occurring to that child. The sad truth is that it can seem easier to remove a child from the home than to, quote, work the case. The robust services needed to preserve a family and their community do not exist. High turnover rates hinder the continuity needed to establish rapport. Whatever we do to keep a struggling family together, there is a risk it will not work out well for the child. This is the risk that DHHR seeks to assign to a private entity. Just last Thursday, DHHR mentioned in testimony that the managed care organization would likely contract with existing provider agencies for care management services. This would seem to me to be a clear conflict of interest in which a care manager could favor the services provided by their own agency. We could do right by our children for a fraction of the $33 million we're going to pay a private company and its shareholders. What if we had the family education, prevention, and preservation services in place, not to mention an earned income tax credit, that would keep the original failure from occurring? For part of that $33 million, we could certainly hire the professional staff to assure that foster families are safe environments where children can live as normal a family life as possible. Others will speak about the foster care provisions, but in short, why make it easier to become a foster parent? Why not focus on making it easier to be successful as a foster parent? If the legislature does rush headlong into House Bill 2010, then at the very least, implement two things that DHHR has acknowledged as options. Create an independent ombudsman to provide real oversight and accountability, and postpone the inclusion of socially necessary services in the contract until after the full implementation of the Federal Family First Prevention Services Act. Thank you, and I brought copies for you, Mr. Chairman.
Thank you, Mr. Hickman. Next is Stephen Smith.
Thank you. My name is Stephen Smith, and I oppose this bill because I am a foster parent of a 5-year-old son. He'll walk up to anybody and give them a hug and a kiss. This Saturday at Kroger, he must have hugged 4 total strangers. He bounced through 4 foster homes in 3 months before joining us. He's not outgoing. He hugs everyone he sees because he's learned that he can't be sure where the next reliable hug is coming from. My wife and I worry daily. Are we giving him enough discipline? Are we giving him too much? Have we put too great a burden on our biological son? Being a foster parent is the hardest thing my wife and I have ever done. Meanwhile, we must also navigate 8 separate people with 8 separate interests along the way: a DHHR worker, CHS worker, guardian ad litem, judge, 2 attorneys, a CASA worker, and a prosecutor. Those folks are necessary. But now you want to add a 9th person, an insurance claims person whose job depends on making his insurance company some money. When they tried something like this in Texas, it was found that the company denied 10 doctor-recommended treatments per day. Thousands of formal complaints were lodged by nurses, by parents, by judges, and even by employees of the insurance company about inadequate services. When something similar was tried in Kentucky, they found that the main way the company made its money was by reducing the output of behavioral health services by 9%. That's 1 in 11 children not getting services, and I don't want that to be my son. My son does not need less care. He needs more. My wife and I do not need more bureaucracy. We need less. Chairman Ellington, please don't make it harder on us and your constituents in Mercer. Vice Chairman Hill, please don't make it harder on the families in Nicholas. Speaker Hanshaw, Senate President Carmichael, please don't make it harder on all of us and our 6,700 children. This is the oldest story in West Virginia politics: David versus Goliath. In this case, David is the 6,700 most vulnerable little souls in our state. There are no high-priced lobbyists on our side, just charities and foster parents missing work today. We can't offer you big campaign donations like our opponents have and will. We just hope you'll ask yourself why this plan that is supposed to benefit foster kids has a small army of foster parents opposing it with all our might. And remember, David wins in the end. Thank you.
Thank you, Mr. Tuck. Jim McKay, or Mr. Smith. Stephen Tuck next.
Thank you, Mr. Chairman, and thanks to all the legislators for your engagement in the issue of foster care. We really appreciate that these first few weeks of the session. I recommend that the MCO part of House Bill 2010 be separated out. I understand there's 2 other bills that are for that alone, and I think that would be a better way for the committees to proceed. Those are House Bill 2206 and House Bill 2437. And I feel the Chapter 9 part of the bill should be separated from the Chapter 49 aspects as one of my recommendations. The foster care reform side of the bill, I suggest the following additions, and they're all from Children's Home Society's public policy agenda for the last several years. Raise the rate, the foster care rate, to acknowledge there's been no increase in a number of years, and that the benefits this would provide foster families and the agencies that work with them. Bolster the support that kinship caregiving families receive, specifically receiving a stipend immediately upon having a child placed in their home and given a certain amount of time to pursue certification. Establish a statewide foster parent association with formal meetings regularly that provide input, substantial input into state policies. Establish an independent ombudsman program for foster parents, adoptive parents, kinship caregivers, relatives, to resolve and mediate issues that arise in the care of children in the state's custody. And finally, establish what might be called an adoption incentive or an acknowledgement of the permanency achieved for timely and successful completions of adoptions that would give agencies additional resources for recruiting new homes for those who have adopted and no longer are fostering, and to bolster the post-adoption services that those agencies can provide to adoptive families. Thank you.
Thank you, Mr. Tuck. Jim McKay.
Good morning, Mr. Chairman. Thank you for this public hearing and members of the committee. My name is Jim McKay. I'm the State Director of Prevent Child Abuse West Virginia. We are part of Team for West Virginia Children and a chapter of Prevent Child Abuse America. I rise to express concerns with this legislation, many of which have been already shared by my colleagues, including Mr. Hickman with the National Association of Social Workers. We do applaud the goals of this legislation, the intent behind it. We agree that this is a issue that requires all of us working together. We care about our children and we want the best for them. We want to promote their well-being. So we owe it to them to get it right. We agree that there is an urgency to addressing this, but we also encourage that we go slow. I heard just recently, there was conversation about when we take an action and then we have a little bit of a regret. And I was thinking about this urgency. If I'm in a hurry to get somewhere, I may come up on that railroad crossing and I got to get there. But the railroad crossing is saying it's not safe right now. There's all these signs saying not safe. I should not cross that railroad crossing when there's all these signs saying there's a train coming. And so we owe it to ourselves not to take the shortcut and make things worse. We need to go with a deliberative approach that listens to the voices of parents, parents who have children in the foster care system, foster parents who are caring and opening their homes, and so forth. So briefly, what we're proposing is 5 items. 1, we need to focus on prevention. How do we prevent child maltreatment in the first place? West Virginia has in the past expanded our home visiting programs for early childhood. We've built systems out there, but those have been stagnantly funded. We don't just have a supply problem when it comes to foster care, we have a demand problem where we are having too many children, too many families in vulnerable situations. We're not doing our responsibility to keep the children in their biological homes and support the families in that way. Secondly, we need to listen to the voice of parents, as I mentioned. There's provisions in the draft contract. I would point out that's 738 pages long that talks about the care coordinators from the managed care organization being at the MDT, the multidisciplinary team meeting, at the request of the judge or at the request of DHHR. We would like to see that at the request of the parent as well, because they may want to have that conversation and so forth. So we want to lift up the voice of parents. We want to make sure there's network adequacy. That's a managed care organization approach. We have several counties in this state that don't have a pediatrician, much less a child psychologist, and the needs that we have. We need to plant those services and make sure we are doing all we can to make sure that network adequacy is ensured. We need accountability. We agree with the comments about an independent ombudsman. Georgia has one. We know that the state is looking at Georgia as a potential model. So how do we work at that? We have a senior citizens ombudsman. We do not have currently an independent ombudsman for children in foster care to navigate the decisions between judges and social workers and parents and the care that goes in with this level. So we would strongly encourage exploration of that. We need a quick appeals process and ability to ask for help when that goes in. Lastly, we would recommend a phased-in approach. New York took 5 years to implement managed care for health care needs of their children in foster care. They started with building those networks of support and those community programs, and they built towards that. West Virginia is proposing doing that much quicker, and for a much broader audience that includes the social service needs, the Family First Prevention Services Act. I sat with Senator Orrin Hatch advocating for passage of the Family First Prevention Services Act. It is a potential game changer, but it is still being articulated at the federal level by the Trump administration. So we don't know what we don't know. And so absolutely, there's probably a role for managed care in implementing it, but we don't have those answers yet, so we should owe it to ourselves to go at a deliberative pace. And yeah, so I'll end with that. We want to make sure we're addressing not just the supply problem, but the demand problem by supporting our children and families before harm meets them. Thank you.
Thank you, Mr. McKay. Gail Higgins.
Good morning. Thank you for allowing this open hearing. My name is Gail Higgins, and I am a CASA volunteer. That's a court-appointed special advocate for children. I'm not comfortable in addressing you about this, but I am very concerned as I have read House Bill 2010 and grappled with trying to figure out where the department is going with this. I've wondered what research is behind it. I've wondered how transparent the behavior of the managed care organization will actually be. All of the people who have spoken have really provided excellent ideas. However, I think we need to slow down. I do think we need to involve stakeholders. I do think we need to scrutinize this process. I am in foster homes every single week. I speak to foster parents. They're not just private agency foster parents, they are also DHHR foster parents. I know how complicated and difficult this endeavor is to be a foster parent. And I also know how very complicated the children's situations are. Many times, children who have experienced trauma do not exhibit it until some point into a placement. That's when foster parents need a lot of support. We have many problems with the system. I think it's wonderful that the legislature is concerned about fixing this system, but I do urge that we have caution and that we provide ways to have accountability and transparency as we move forward. Thank you.
Thank you, Ms. Higgins. Carrie Jo Grace.
Thank you. My name is Carrie Jo Grace. I'm with the Our Children, Our Future campaign to end child poverty in West Virginia, and we would like to echo the statements from Team for West Virginia Children and National Association of Social Workers, but I also have two statements to read from foster families. First one, I'm Lindsay Amy. I've adopted 3 children through foster care. One we received when she was 3. She was so far behind she could only say about 5 words. She had a lot of trauma and regressed several times. With the medical card she has now, we were able to get her help close by. With the MCO, we would have to travel an hour and a half one way. That will make it very inconvenient in winter. Plus, all of the special needs would not be taken care of. She deserves more than the government and insurance companies lining their pockets from foster children. And the second one, hi, my name is Angie Davis, and I'm the mother of Trevin, who is currently 5 years old and attends kindergarten at Tucker Valley Elementary. Trevin was a victim of neglect because his mother and grandmother abused drugs. Sometimes he was left in his crib all day because they were passed out. He has extreme anxiety and anger issues. His fine motor skills and cognitive skills have been about a year behind other children his age. According to occupational therapists, he doesn't cross midline and his core is underdeveloped. These are not things that I have ever heard of as a parent, and if Trevin had not been able to visit occupational therapists, his development would be more behind than it is now. At first glance, he looks like a normal all-American little boy, but if you spent a day with him, you would realize he struggles daily with simple tasks and struggles to remain calm trying to do something as simple as open a bottle. His Medicaid card has enabled me to give him all the medical care he has needed, which has been regular care, major dental work, occupational therapy, and psychiatry. I know other foster, adoptive, kinship parents with multiple children who are struggling with various diagnoses that make a daily living a struggle in their household. Unless you have parented a child who is dealing with the trauma of neglect and abuse, you cannot know the daily struggles. There are medical issues, behavior issues, learning disabilities, developmental issues, toilet training issues, fear, anxiety, anger, eating issues, sensory issues, and the list goes on. This affects every aspect of the foster, adoptive, kinship family that this child belongs to. Everyone and all the relationships are affected. It is not a job for the faint-hearted. Foster, adoptive, kinship parents and families need more support, not more red tape and stress. We have learned from other states like Texas that managed care did not effectively support families, but instead profited from these children, all the while denying medical procedures that were necessary. With a foster care crisis, decisions for improving the support and structure should be in the hands of those already doing the work. We are organizing and supporting one another in pockets across the state, as well as statewide online. We have ideas and we have experience. Please do not move forward with this bill. I believe there are other areas concerning foster, adoptive, kinship care that are more pressing. And there's a picture at the bottom. It says, this picture was taken last year and illustrates our first cuddles at almost 5 years old after a series of intense occupational therapy. Before this, he never allowed me to hug or comfort him. Thank you.
Thank you, Ms. Grace. Kristen O'Sullivan.
Thank you, Chairman. I'm Kristen O'Sullivan with Our Children, Our Future. We are a group of partners working to make West Virginia the best place to live, work, and raise a family, no matter who you are. That includes our foster children and our foster parents. When we take, as a state, feel it's necessary to take a child into custody, those children become my children. Those children become your children. And we want to make sure that they're receiving the services that we would want for our own biological children. We speak in high opposition of this bill, not because there may not be some good ideas that need to be flushed out, but because they have not been flushed out. And they've been done in a way that really looks against those things that we have found to work in the past, which is foster parent involvement, youth involvement. I became a social worker here in West Virginia back in 1990. And during that time, there was a program from the legislature for some test counties for wraparound services. I was down in Mercer County and had the great fortune of starting my career helping on committees to develop wraparound services for individual children. Because it was very community-based, individual-based, foster parent-based, we were able to find great success. Sadly, the funding for that disappeared, and I moved to Georgia for many years and ran a runaway and homeless youth shelters out there, came back, and all of that was gone. Our concern is that this is moving forward too fast. We're not looking at what has been successful here in West Virginia, what we can grow from, how we can involve our communities and our foster parents directly in that. And just a little breakdown on some math here. So if we're talking about $33 million going out in profit or going out to a managed care organization outside of our state, that $33 million could easily break down into $600,000 per county to improve the services for foster care children in that community based on that needs of that community. It also breaks down another way, if you want to look at it differently, 6,700 young people in foster care. That means I have not just 3 children at home, I have 6,703 children that I have as a West Virginian. And those children, with that same money, we could have $5,000 more per child to seek the necessary services that they need. I ask you to slow down. I ask you to be very, very deliberate in this. And please, please, please involve youth and involve the foster parents who are doing the real work.
Thank you, Ms. Sullivan. Terry Pickett.
Hello, thank you for having us this morning. My name is Terry Pickett. I am a volunteer with Rise Up West Virginia, which is a grassroots advocacy group whose one of its main missions is to improve the lives of West Virginians. I'm talking about this bill. It's looking like House Bill 2010. It could be so potentially destructive, and I think you all have heard many of the ways that it could be so. One of the main things could be, is what Kristen was just talking about, that we could have, what is it, $600,000 for every county if we didn't spend $33 million for an out-of-state managed care group. Minimally, we really need to have a fiscal note, see what it would cost, see what we could do to spend the money here and not for an out-of-state group. Another thing is it would make services, it would put another layer on getting Medicaid and other services to our children. So how much will that cost, and how much longer will that take, and how much more difficult would that be for foster parents? And the other thing is that there's a lot of research out there showing that managed care organizations have bad outcomes. So I will be very short. It seems to me that not to do some slow down, as people have said, do a really detailed, careful study of this bill, because I'm sure the people who want to do this, they want to help West Virginians. They don't want to hurt West Virginians, but this bill could do just that. Thank you.
Thank you, Ms. Pickett. Patricia Fast.
Thank you, Chairman. My name is Patricia Fast. I'm Vice President of Government Programs for the Health Plan, formerly known as the Health Plan of West Virginia. We are a not-for-profit 501c4 corporation who've been providing managed care services to West Virginians since 1979. I'm almost as old as the mortar. I've been there for 36 years myself. We have served Medicaid children since 1996, when we became a Medicaid MCO in West Virginia. And we locally employ 530 employees. All of our employees who service West Virginia families and children are located in our 3 West Virginia locations. So we look at this a little bit differently than some of you, obviously, but I think we have the same ultimate goals. We believe that the medical care and the social care has been fragmented and not delivered in a coordinated approach. We believe as an MCO we can bring more coordination of that care. We've heard mention here today of concerns about network adequacy and network concerns, and I assure you that DHHR reviews us with a fine-tooth comb regarding our networks, and that if you look at our network list, you know, probably 98% of the local providers do participate with our plan, and we would assume the social service providers under the foster care program, we would take that same approach with them as well. And we agree with whoever said that this is not a silver bullet. We don't think an MCO approach alone is a silver bullet. We think an MCO approach that looks at collaborating with all of you. You know, several months ago, I presented to DHHR on what the health plan believes. And one of the things that we said is we need to develop the best collaborative, holistic approach to meet the needs of the child and the family. We all know that changes need to be made to this system, and we believe that through an integrated approach where we can work with you to help coordinate the services in a transparent manner, not necessarily, go against what you're saying, but just try to, facilitate the best care for the child at the right time, at the right place, to work with the providers in the community to make sure services available to children when they need it. I encourage any of you to. A lot of you have a lot of questions about managed care, and I understand that. You're welcome to visit the health plan anytime. Like I said, we've got offices here in Charleston, in Wheeling, and in Morgantown, and we'd be happy to show you and explain more what we do. Thank you for the opportunity.
Thank you, Ms. Fass. Chantal Fields?
Good morning. I'm Chantel Fields. I'm the Executive Director of West Virginians for Affordable Health Care, and I'm here today to show support for House Bill 2010 that proposes the creation of a managed care program for foster children. We have heard over and over this morning that West Virginia is experiencing a child welfare crisis, mainly due to the opioid epidemic in our state. We know that we have over 6,700 kids in foster care who are in need of coordinated health care services, mental health care services, and a variety of social services to ensure their health and safety. As we have said before, we see this as a health issue for our children. As healthcare advocates over the past few years, we have heard stories from foster families who have told us that children are being placed in their care with a variety of healthcare and mental health issues in need of immediate attention. However, often they will come with no health records, no health histories. They may have medications that the foster parent doesn't know what the child is being prescribed for. They may not even know who the last doctor was that the child has seen. Yet now they're responsible for this child's health with little or no information or records to work from. We believe that an MCO program could really help with this type of situation. For this specific population of children and families, this is a meaningful opportunity to provide coordinated care, intensive care management, centralized data management, uniformed procedures, continuity of care, comprehensive medical histories that follow the child as he or she navigates between systems and locations of residence, oversight and improvement of quality of health care within these retrospective systems, access to accurate and actionable data regarding utilization and quality of care for these kids, through creation of a stakeholders group to monitor the program, provide oversight, and recommend innovative changes, and steps to creating a public-private strategic plan to address the health and social support needs of this vulnerable population. It's worth noting that Medicaid is a health insurance program that currently covers 1 out of every 2 children in West Virginia, and that MCOs have been providing the care for those children in Medicaid for over 10 years now. Those children who are enrolled in Medicaid MCOs are receiving high-quality, coordinated health care. We believe that our most vulnerable children, those in crisis, should be allowed the opportunity to also receive those coordinated care services. Thank you.
Thank you, Ms. Fields. Ms. Sally Roberts?
Thank you for letting me speak today. My name is Sally Roberts Wilson, and I'm from Morgantown, West Virginia. I'm here to express my concern and opposition to HB 2010. A recent committee hearing touted the cost savings that this state would incur by entering into an MCO agreement. I would like to point out that a cursory Google search provided a recent September 19th, 2018 article in the Des Moines Register, which stated that contracting with the MCO tripled the costs per child of health care and this data was provided by the Department of Health and Human Services. An ABA report following a 2-year investigation into state foster care practices An investigation by the Senate Finance Committee released an extensive report outlining the myriad problems discovered. This was a bipartisan report. The investigation found that the children in the care of private companies, such as the Mentor Network based in Massachusetts and operating in approximately 26 states, are plagued by shortcuts taken by these companies to increase profits. Inadequate screening of foster parents in other homes, increasing workloads for social workers, high social worker turnover, filling beds using a quota system, and hiring unlicensed workers were a few of the root causes leading to rampant abuse and neglect of youth in privatized care. At the same time, public funding is being funneled into these agencies at high rates. Contracted private agencies are failing to meet the standards on action plans. This report contains specific recommendations for states and tribes, the Department of Health and Human Services, and Congress. It contains specific data from individual states and a number of appendices that delve deeper into the report's methodology. And it provides an outline for ways that we should improve the tracking of the care provided by these privatized foster care entities. And I'd like to submit this for the record. Finally, I'd like to say I was compelled to come here because, as was stated, Medicaid does provide a managed care system. I had to undergo respiratory therapy. One of the young women that I was in respiratory therapy with was on the Medicaid program in West Virginia. She was young. She had a 6-year-old child and another on the way, and she needed a lung transplant. She had been to 3 different facilities to get the lung transplant, only to be denied at the last minute by the Medicaid program because they were out of network. I don't know what happened to that young woman or her children. I don't know whatever became of her. But what I do know is this concerns me. When we have, just in the private prison industry, whose incentive is to fill prisons in order to maximize profits, so too when the profit motives of MCOs rely on per-child treatment, there is a perverse privatization incentive to move out of foster care back into the families or into permanent homes. They will make more money if they keep more children in foster care, not getting them out. When we provide health care, when we provide human care to our children in this state, we need to consider their needs, not the profit motives of private companies. Thank you.
Thank you, Ms. Roberts. Ben Beeks.
Thank you. Ben Beeks with the West Virginia Association of Health Plans. Johnny had enough to deal with. For an 11-year-old boy, he should have been focused on ball fields, video games, and complaining about homework. Instead, Johnny was wondering what his world was going to be like. Like many children in West Virginia, Johnny was removed from his home because both of his parents had overdosed. He had just transitioned to live with his new guardian, his grandfather. Once the care manager for the managed care company made the new member outreach, she quickly realized that Johnny had more challenges. He was a severe diabetic. Johnny's grandfather did not know how to care for Johnny's diabetes. His most recent blood sugar test was 411. He was nauseated. He was unable to eat. The care manager was able to provide instruction to Grandpa on how to test Johnny's blood sugar and administer his insulin. And just days after Johnny's new member meeting, the care manager referred him to a disease management nurse with clinical expertise in diabetes. Johnny had several setbacks and several challenges with his diabetes. It took several adjustments, different medical referrals, and a lot of coaching to get Johnny on the right path to good health. Most importantly, the care manager gave confidence to Johnny's grandfather to be an active advocate for Johnny and better manage his condition. The same can be said for Jessica, Teresa, and Alexandra, who were expectant mothers, yet they had a drug addiction. It was a care manager who worked with them through their neonatal abstinence program. At the end of the program, not only was the health of their baby better, but because of the intervention of a care manager, Jessica said, "I'm able to lead a normal lifestyle." These are actual cases from West Virginia's Medicaid program. These are direct results of managed care. There have been many questions surrounding managed care, and we understand. When contemplating a shift in policy, one should ask tough questions, and you are. But managed care is not new to West Virginia, and it's certainly not new to serving vulnerable populations. Managed care has had a role in West Virginia's Medicaid program since 1996. Currently, MCOs manage the care of roughly 400,000 West Virginians, 150,000 of which are children. We are an established and trusted partner of the state of West Virginia. Some have raised concerns over the cost of managed care and utilizing the services of a private company. According to testimony at a recent Legislative Oversight Commission on Health and Human Resources Accountability, the current foster care system is bifurcated among roughly a dozen different programs. MCOs have a service which provides value. With the bifurcated system, a system that arguably lacks critical coordination, are the children in foster care getting the value that we want them to have? Managed care is not the end-all solution, but our expertise can certainly provide a holistic approach to coordination and care delivery. Johnny benefited from the care of a managed care company. My question for this body is, why shouldn't the thousands of children in foster care benefit from managed care as well? And just a point on the transplant question, I appreciate that being raised. The managed care companies are excluded from managing transplants. Those are solely held with the state of West Virginia. So that decision was not with the managed care company. I just wanted to correct the record on that. Thank you very much for your time.
Thank you, Mr. Beeks. Betty Rivard.
Thank you for the opportunity to comment. I'm Betty Rivard, and I'm a volunteer independent citizen advocate. I am totally against putting child welfare and foster care under an MCO corporation for the following reasons. One, the crisis we are in does not justify a revolutionary change in our systems. Two, this is a solution looking for a problem. At the same time, we are ignoring the real problems we have around the state, as noted in my handout. And I request that the staff get my handout around to the committee members. It has 8 issues and other solutions that we need to consider for those issues. 3, some communities across the state are already successfully dealing with problems that they have identified. Huntington, Wheeling, and Mercer County come to mind. We need to know more about what's working. 4, moving to an MCO will create systems that can interfere with our own local solutions. The contract itself, as several have mentioned, will take at least $330 million out of our state, with 10% or $33 million going to a combination of corporate administration and profits. This means that much less money for solving our own problems. Finally, number 5. Maybe the worst thing, from my point of view, is that based on what I have read in the contract and other materials, the new systems are built on call centers or possibly even home-based callers whose decisions will affect our most vulnerable children, youth, and families without ever even meeting them in person. You who are legislators probably know better than anyone how our culture is built on relationships. These relationships are the key to your being elected to represent us and to your work here. People of all ages who are going through serious changes in their own lives must have in-person support to guide and nurture them. I have found nothing in this contract that requires that the MCO provide that kind of in-person support. And I'll just mention I worked for the Department of Health and Human Resources for about 25 years, and I know from my experience there how casework is at the essence of child welfare. There are problems with casework, but those are problems that we can address in terms of getting more staff, having better retention, and in general, encouraging coordination among our systems. We must start over and work together to make the right changes, to get the job done. We are the parents of these children and youth in state custody. They deserve no less. Thank you very much.
Thank you, Ms. Rivard. Gary Zuckett. We just have one more speaker after Mr. Zuckett.
Thank you, Chairman Ellington and members of the committee. It's good to see a full house here. Yes, we have a foster crisis here in West Virginia. But I'm not sure that rushing into an MCO is the way to go. Yes, we need massive improvement in our policy in dealing with this house fire that everyone agrees is a major problem, but we really must make sure we're not throwing gasoline on the fire instead of water. There's way too many questions that remain unanswered at this time. One of the biggest ones is what is the cost for this? Where's the fiscal note? I'm hearing numbers bantered about, but where are they coming from? And how disruptive would this switch to managed care be to children that have good care now? Will they be able to keep their doctors if they're not within the network? These are all our kids, as been said. We all want to do what's best for them. But as already been said, managed care is not a silver bullet. How will the managed care organization, whichever one is chosen, balance the capitated revenue stream and the multiple needs of foster kids under our state care? Will the need to turn a profit shortchange our foster kids? As I said, there's way too many questions hanging out there. Let's slow this train down and do it right. Hasty fixes may make the crisis even worse. Thank you.
Thank you, Mr. Zuckett. Jill Rice.
Thank you, Mr. Chairman, members. My name is Jill Rice, and I'm here today on behalf of Unicare, one of 4 managed care organizations that currently coordinate care of Medicaid children and adults in West Virginia pursuant to its existing contract with the state of West Virginia. Unicare supports House Bill 2010. An MCO, Managed Care Organization, serves as a centralized point of contact and will do so to assist the children and the child and their caregivers in navigating all needed services and programs in both the healthcare and child welfare systems. As all of us know, and as all of us have discussed today, what we really are recognizing is that these children in foster care have very unique experiences. They have significant trauma and face a number of other social and environmental factors that affect their long-term health and well-being. Many of them have extensive physical health and mental health conditions, intellectual and developmental disabilities, and substance use disorders. They have unique social challenges that result from their lack of environmental stability. And perhaps before children are placed in foster care, what we unfortunately know is that they have been exposed to violence and poverty and have experienced abuse and neglect. MCOs do have the expertise, the experience, and the flexibility in program design to work with the agencies involved in the children's lives to jointly develop the most effective and comprehensive system of care. MCOs integrate the full child's life experience: healthcare, welfare, education, career preparation for transition-age youth, and other social services and supports in collaboration with the state agencies and creating a single point of accountability, and that's been lacking. This, in turn, significantly increases the likelihood for improved outcomes, safety, stability, and overall well-being. We've heard a lot today about a holistic approach. I use the term 360 degrees. This bill is an opportunity to comprehensively address the various risk factors influencing these children's lives in a 360-degree way. In Georgia, we've talked about Georgia. In Georgia, one foster youth who moved to a new placement within the child welfare system did so without his medications. Immediately, the Georgia Health Plan was able to assist with identifying the medications that the youth had been prescribed in the last 3 months and assisted with securing those. The state of Washington transitioned its program and had a serious incident with a child, a 2-year-old born with significant developmental issues that caused bleeding and issues as a result of head banging. The caregiver at the time expressed to the managed care coordinator, "I can't get this 2-year-old in for an appointment in 3 months." Obviously, that was a serious concern. The managed care coordinator said, "Go to the hospital. There could be traumatic brain injury. Go there immediately." And while the person and the caregiver and child were at the hospital, the caregiver through the health plan arranged an appointment within 1 week, and they had a short-term plan until the appointment was had a week later. House Bill 2010 is an opportunity to comprehensively give these children and the youth the best opportunity for the best outcome possible. We support the bill, and thank you again.
Thank you, Ms. Rice. In light of the hour, we're not going to be able to entertain questions today. I'd like to thank each of the presenters for their input and certainly interesting questions that will need to be addressed. House Bill 2010 is on the agenda today in House Health at 2 o'clock, so anyone is welcome to hear that. Chair recognizes the Vice Chair for a motion for us to adjourn. All those in favor may say aye, and this public hearing is adjourned. Yes, you can have it. You might want to, well, you did see that I had my comments next to all of those. You just let him have that. Yes. Martha, let them have a copy of the names so that they can, and the last two that you got on. Interesting. You know, the interesting part is some of those things had nothing to do with the managed care program.
Oh, well.
You still have the mic on up top here.